We're the Hidradenitis SuppuraDIVAS. If you've got HS, you'll want to meet us. It's not your fault, put the shame to a halt. HS divas know how to have a ball. The Hidradenitis SuppuraDIVAS. Put the shame to a halt, cause it's not your fault.
Hi everybody, my name is Brinley. Welcome to the Hidradenitis SuppuraDIVAS podcast, sponsored by UCB. Hi everyone, and welcome to today's episode of the Hidradenitis SuppuraDIVAS podcast. And I am here today with Mahala Prudhomme and Sydney Carter, and we have as a special guest on today, Dr. Keira Barr. Dr. Barr, welcome. Thank you for joining us.
Thank you. I'm excited.
Yeah, we're excited to have you. Dr. Barr is here to talk to us today. She is a psychodermatologist and dermatologist, and she has a special affinity for HS. And I actually met her at the Integrative Dermatology Symposium like 2 years ago, I think. And we ended up being on the same flight back to Seattle and just, anybody who knows me knows that I can talk about HS until I can't speak anymore. But yeah, we had a wonderful conversation while we were waiting for the flight and just more about what Dr. Barr does. And it's fascinating. She has a really unique take on HS and the way that it impacts us, as well as medical trauma and those kinds of things. And then she's also worked out a new way that she's looking at handling skincare and the way that it impacts our life. So I'm super excited to have her on today to talk about all of those things and let us know what pearls of wisdom she has for the HS community too, of how we can do a better job of maintaining and helping ourselves through this whole process. So thank you so much again for joining us. You want to tell us a little bit about yourself?
I don't know what else there's to tell. I feel like you
She's great, isn't she?
She's amazing. No, it's so true. I've been in dermatology. I'm dating myself, but it's been, I've been in medicine over 27 years now. And, if you had asked me a decade ago why I went into dermatology, it would have been because I loved the mix of medicine and histology and surgery and dealing with kids and adults. But, my own health started falling apart about 10 years ago, having to diagnose myself with gut health issues, hormonal issues. The focus of my practice was skin cancer, melanoma, so oncodermatology, and having to diagnose myself with melanoma. And really, that was my wake-up call that our skin, is talking to us all the time. Our body is talking to us all the time. And most of the time we are ignoring those signs because they're too painful. We think of them as a nuisance. The messages and messaging we've gotten from society is that if something is showing up on your skin, there's something wrong with you. You should just camouflage it and cover it up. So that's what I did for most of my life. And I realized, that doesn't work. That really doesn't work. And so I realized now, if you were to ask me that question, why I went to dermatology, it's because for most of my life, I never felt comfortable in my skin.
Wow.
I think most of us probably walk around this world not, going back even further as a kid, I was born with 2 birthmarks, one on each side of my face, and kids would bully me as a kid in elementary school. And I learned very quickly that our skin could be a source of shame and embarrassment. Yeah. So my attempt back then was to hide it with suntan, but I burn very easily. But I ignored that. I didn't care how much pain. I didn't care how much my skin peeled. I was going to cover it no matter what, because being made fun of at that stage of my life was more painful than the pain of the sunburn. Fast forward, lots of sun damage, skin cancer, become a dermatologist, realize, oh my God, that's not
what have I done?
Yeah. So a very long-winded way of saying, I get it. This, we need to change the narrative globally of how we address skin health, skin disease, skincare, right? Skincare isn't just the products that we're applying to our skin. Yeah. It goes much deeper than that surface. And so that's really what I feel very passionate about bringing forward. And I think that's how you and I really connected and bonded, because, those who are in the HS community know intimately how our skin can be a source of discomfort, both physically and emotionally.
Yes, absolutely. And when you said shame, that word just resonates. I think it's synonymous with HS. They should be just interchangeable. You know, it's unfortunate that most of us feel that way. And I appreciate that you can understand so much of like where we're coming from, because it's such a hard disease to manage, and the amount of shame that we feel about it, it impacts so many other things in our life. I think way more than we realize. When you stop to think about the fact that we're actually neglecting our own healthcare in a lot of ways because of our HS, because of the embarrassment and the shame. You're not maybe going to get mammograms the way that you should be to detect early breast cancer. You're not going and getting your pap and pelvics because you're afraid of the OB-GYN or somebody seeing that you have HS in your groin. All of these things it's really burdensome to us because we're afraid to go and do what we need to do to look after ourselves because of all of the shame that we carry about it. And then when you stop and think about like how much damage we could actually be doing to ourselves by not taking care of our health and neglecting it because of this shame, it's like, if that was your friend telling you, I always try to think about that. If my friend was telling me that she wasn't going to go and get a mammogram because of her HS, I would be like, absolutely not. You need to go.
Yeah.
So we need to take that and apply it to ourselves,
Yeah.
like whatever advice we would be giving other people.
But I think there's something so unique with HS and the experience too, because like, okay, if I see a dermatologist, cool, I'm cool. I know the dermatologist knows what HS is. But if
In
I go
most cases.
I mean, in most cases, assuming they do, you know, but if I go get a STI test, I'm like, oh, this OBGYN might not know what HS is. Is she immediately going to think this is herpes? And it's silly, but I still have...
I get comments almost every video that like they think that it's herpes and it's not.
Yeah. Which there's nothing wrong with having herpes either. But what I'm saying is it's like there's still so much shame behind it. And I think it's very hard because like I love hearing your perspective as a doctor who has the skincare, like skin issues too. But I'm also like, I don't go to the doctors to hear y'all's stories. I want y'all to fix mine, you know? But it's like, I think that's why these conversations are so important to have outside of this. Because like already there's a comfortability with you because I'm like, oh, she knows the shame behind skincare, you know?
Yeah.
So
yeah,
thank you for
beautiful.
the perspective.
Yeah,
It was
yeah.
amazing.
Yeah, and like you had mentioned, even with your own experience, that you're willing to like do whatever damage and take that and be happy with it in order to just not have to live with the shame that you're feeling carrying that, you know, in your case, the birthmarks. And it's incredible. I totally appreciate that view.
And I don't know if a lot of healthcare professionals know that, but I think there's something superhuman about you guys to patients. And so I think it is nice just hearing like, oh, wait, you're actually a human. you had something on your face and you went and self-tanned.
We feel it too. Yeah.
Yeah.
We're totally insecure and have our own stuff going on.
Yeah.
I think, you know, the biggest issue and the challenge, you know, even going outside of HS, I think as socialized as women and now as a midlife woman, everything that we are, we're not supposed to be. I'm not supposed to be aging. I'm not supposed to have blemishes on my skin. I'm not supposed to have wrinkles. I'm not supposed to have abscess. I'm not supposed to have anything that isn't considered
Societally appropriate.
The societal norm, right? And that creates a lot of shame. And all that, I think, you know, as Brene Brown said, you know, like shame grows and shame, you know, is allowed to, it's based on our secrecy. It's speaking about it diffuses, right? The more that we can talk about, this is hard. This is something that I live with. I didn't ask for it. I didn't want it, but it's here.
And I think it's deeper. Sorry, I don't mean to cut you off, but like, I was just so moved by your perspective being a dermatologist, but I think it speaks waves to even like the makeup community. You know, how many do we see? Like even myself, I'm not exempt. The acne, but putting makeup on your face every single day is kind of not helping your situation, you know, but we think that we have to apply this makeup to be done up going outside and not just like we're looked at. Like if I didn't wear makeup today because I have a sty, I would have been like, oh man, like I don't want people to perceive that I didn't take this seriously. So I put the makeup on. But you set me free kind of just like, okay, tomorrow if the sty's acting up, girl, don't wear the makeup. Like it's not going to help. It's going to hurt and make it worse. And you're covering that up for what reason, you know?
I think, you know, I love that so much. And you're right. And here's the thing. I'm not anti-product. I'm not anti-makeup or procedure. I'd be a complete asshole Is that okay to
Yep.
say that?
This is a podcast we cuss.
I'm a complete hypocrite. I've had Botox, I've had filler, I wear makeup at times, but I've come to understand my why for doing it and being very intentional. I am not doing these things because I'm trying to hide who I am. I want to be proud and accentuate the features of myself that I actually admire and adore and am grateful for. The makeup, right? This idea of covering up something. Your skin is a living, breathing organ. It is your most visible organ. It is your largest organ, and it is talking to you all the time. Our brain and our skin are intimately connected. They are derived from the same layer of embryologic tissue. They are communicating with each other all the time. So right now, talking to all of you, even though I've spoken in front of hundreds, thousands of people, my pits are sweaty right
Oh
now.
my God. We were all like, we're
You're
not the only one.
I'm a little nervous. And that is my brain talking to my skin. When we are flushed, when, we are speaking to someone or, hives, right? That is our skin's way of letting us know it has something to say. Nothing has gone wrong. Same thing with the sty or the breakouts, right? It's an invitation, right? Society would have you believe that there's something wrong. You need to cover that up. You need to treat it. And yes, we want to address it. But what those quote unquote blemishes are inviting us to consider is, hey, beneath the surface, our body needs some attention and care. That is what skincare really should be.
Yeah, that's beautiful.
Right? Our body needs our attention and care. And just slapping some cover up on it or some makeup on it is a good quick fix if it helps us feel more comfortable in our skin to go out and about. Hell yeah, do that. But beyond that, what more do I need? What words do I need to hear? Who in my corner do I need to go to? What do I need to look at in terms of my lifestyle? Am I sleeping? Am I nourishing myself?
Yeah.
Like you said, really, like not going to whatever exam for your overall health and well-being. No one deserves that, your health, more than you, like to bypass or to sacrifice yourself to please somebody else. And unfortunately, those are the messages. And it's not your fault. And you, meaning you euphemistically, like those are the messages that we've been sent for way too long. It's time to just like flip that script.
It is. And it's hard to start. Like, where do you start with switching that around? Because it's been ingrained in us for how long that we have to meet these norms and be seen as beautiful in society. And we all know that HS is not considered a sexy disease. It's not, they even alopecia areata is a sexier disease. Eczema and psoriasis are so well known that people don't question when they see something like that on someone's skin.
Or place the judgment on the person.
Yes.
Like, oh, you have psoriasis because it's your fault. Like,
oh, your mom must have used the Tide that wasn't the Free and Clear. But for some reason, like, we still walk around with HS carrying that weight of the self-blame and the blame from other people and the shame from other people. And how do we start that change? What does that look like?
Yeah, it's a great question. And there is no simple answer because each of you have your own journey, your own story. But I think it starts with a decision.
Yeah.
Decision that I owe it to myself enough not to sacrifice my health, right? I'm making a decision that I want to be more comfortable in my skin, right? I think it's a big leap for many of us to be like, I'm ashamed, to like, I effing love everything about myself.
Yeah.
Like that is a huge bridge to gap. And I think that's a little unrealistic, but like, how about, I'm open to the possibility that things could be different, that I could be more accepting, more compassionate. Just like you said, Brinley, how would I talk to my girlfriend if she was foregoing an exam that could potentially save her life? You would grab her by the shoulders lovingly and shake her and being like, WTF. I'm going with you to that exam and you're going to get this done because your health means more than someone's words. You know?
Or potential opinion about,
Exactly.
and that's a lot of it is based on our interactions with other people, because we may be going to an exam where someone is well versed in HS, and they may blow our mind by knowing what condition we have and talking to us about it, and then all of that like worry and concern was for naught, because there are people in the medical field who are very, very well adept at handling HS and who know about HS. So sometimes I'm like, okay, maybe someone's going to surprise me and no.
I'm a go.
And I'm wondering, is that something we should be doing when we're seeing maybe non-derm people? Should we be asking like our physicians if they know what HS is? Like, is that an appropriate opening if we go to OBGYN? Hi, I'm here for a pap smear, but do you know what hidradenitis suppurativa is? Because I have that. Is that like an appropriate thing
I
to
think so,
ask?
because I have had the same midwife deliver all 3 of my children. And I think when she saw me fresh out of high school, she had an idea of what HS was, and she was able to like be open to hearing my complaints and my struggles, and she didn't kind of like, oh, well, this is what you need to do, because she wasn't an expert. We kind of just learned together through the journey of me having children, and she knows labor is really, hard for me, and but we've educated each other kind of together. And I think so many people with HS feel like it's not their responsibility, and maybe it's not, but it kind of is honestly our due diligence back to the medical community, because there is that lack of education. So I think we should be more willing to just kind of educate them together and make it a journey.
Yeah, I love that. And I also think even if someone knows what HS is, like in dermatology training, we learn, right? And we know prescriptive wise, like clinical pathologic correlation, this is what it looks like. This is what it looks like underneath the microscope. This is the prescription, like this is the treatment path. But none of that takes into account your lived experience.
Yeah.
How this is impacting you. And that's the opportunity to really educate, like to create, we are humans, right? Like, but, and in the medical field, and I'm not trying to condone bad behavior, but like, it's a messed up system all over the place. Like physician burnout is an all-time high. They are getting crunched left, right, and center. They get 7 or 15 minutes, even if they want to have the conversation, like, how is this affecting you? Like, how are you doing? Most of them don't have that wiggle room, because on to the next, because they're, and because they're not running their own practice. And it is a broken system. So even when someone knows about your condition, I think it is a beautiful opportunity to be like, hey, this is what's going on with me. This is what's important. Or if they're making you feel a little uncomfortable, and say, hey, that's not okay. I mean, it may not always be comfortable to say, hey, that's not okay. But I think it's appropriate to kind of take a step back for a second, regroup. This is where some of the practices that I teach of like literally just bringing yourself into the present moment, feeling your feet on the surface that you're connected to, your bottom, supported if you're on an exam chair, like just coming back to your breath, bringing yourself into the present moment so that you can kind of regulate your nervous system a little bit, so you can be more responsive to the person who's in front of you and be able to vocalize what is most important to you in that moment. Right?
Because I think sometimes when we especially go to a dermatologist, sometimes we're there for like, can you help my HS, or what can I do to help my HS? And I also think sometimes we're there for more of the cosmetic end. How do I make my HS look better? And I feel like there's 2 completely different motives. And I think I could even get better at saying that to a derm. Like sometimes I'm here to look better. Sometimes I'm here to feel better. You know what I mean? So, okay, just really being more vocal. I love what you said about just like planting yourself, because I think I get so much fear. Like I said, for me, doctors have some supernatural
superhero complex.
And I'm like, oh my God, they're a human, just say it. And I get so much fear.
Just like they only have 7 to 15 minutes. That means you only have 7 to 15 minutes. So like you got to get all your shit out as quick as you can, what you need. And I think that's, it's one of the things that I really want to work with HS patients on, especially because of the shame. And we do still get a lot of shame from the medical field and from people who aren't as well versed in our condition. That most of the people leave after their first appointments. We've built up the courage to finally go to the derm. And then you're told that you need to stop smoking and lose weight. And like, that's the answer.
Right. See you never again.
Yeah. And we lose a lot of people in the community to continued medical care because of that, because we already walk in with the shame and then you walk out with even more shame. So one of the things that I really want to start working with our community on is taking control of those visits. So if we change the narrative and we walk in and say like, hey, I'm here to talk about my HS, not weight and not smoking, let's just cut that off before it even becomes a topic of conversation, because I'm here for medical management. That's what I'm here for. And I think that as patients, we can help encourage other patients to take control of that appointment by just cutting that piece of it out before it even gets there. Because I don't like seeing people leave, we finally go to try to ask for help and then we end up kind of leaving more discouraged, I think, than we went in some cases. So that's definitely an issue that our community is still seeing. So any words of advice for that? I mean, is that a good way to go about an appointment?
I think it's multi-layered. I think taking control of the appointment and your intention, yes, and knowing that you have every right to be there, you have every right to express your concerns. And this is a collaborative. I see, I'm a patient. Like, I want to collaborate with my physician. And there are times when sometimes I'm like, hey, just tell me what you think is best, because I'm at a loss here versus, I have been trying these different things. What do you think about this? Right. So make it collaborative. Your doctor just really wants to help you, unless they're a complete a-hole. And
Yeah.
Yeah.
But the other thing I also want to name is there are a lot of people in the medical space who are being referred to as dermatologists. They're nurse practitioners, they're physician assistants, they're just skin experts. And I see a lot of stuff, especially on social media. Please, please, please make sure you are going to a board certified dermatologist. Even then, HS may not be their expertise, but go to someone who actually has appropriate training and is more well-equipped. That's one thing, because that increases your chances that people actually know what you're talking about and what potentially you're dealing with. The second part is, from the integrative perspective, diet and lifestyle do play a significant role in what shows up in our skin. So I'm not condoning shaming someone for, like, if you're smoking or just telling them to lose weight. I think that's a blanket statement, disparaging, unhelpful.
Yeah.
But I think there is benefit from understanding what are all the things that contribute to what shows up on your skin.
Yeah.
And we call it the exposome. Everything in your environment that could possibly impact what shows up on your skin. Your skin is a window to and reflection of your overall health and well-being. It is also a window to your nervous system, right? The brain and the skin are connected. When we are stressed, when our nervous system is dysregulated, it shows up on our skin. So what are the things that does include? How are you sleeping? What are the things that might be getting in the way? Are you binging on Netflix? Like,
are you stressed? Like,
Yeah.
What are the stressors in your life? Like,
Yeah.
in terms of diet, maybe it's not a weight loss issue, but are there foods or a style of eating that may be more supportive to you? Is there something that's contributing or triggering? We know, especially with acneiform, or acne specifically, but and psoriasis and some other conditions, like stress definitely plays a significant role in stimulating your oil glands, contributing to more oil production, stimulates inflammatory cascade. So that's a thing. There's certain foods that may be more contributed. For some people, it's dairy, and so it's just being curious. So I'm not saying that. And smoking is, creates a lot of oxidative stress and inflammation. And so, yes, there is room for discussion of diet and lifestyle factors, but it's not all the things. So I think, I guess I would encourage, when you go in, not just completely shut that down, because for some people, modifying some lifestyle factors could be very supportive, not just for how your skin looks, but how you feel in your skin, right?
Yeah.
I think it's getting deeper than the surface level questions, like checking a box saying, like, are you a smoker? Yes. And then you're your doctor's putting you in the same box. Like, oh, they're just a smoker. They're a chain smoker. You don't know. Do they occasionally smoke? Do you smoke a pack a day? Are you smoking because you're stressed? Are you smoking because it's just been a habit since you were young? Like, there's always like deeper rooted questions to ask. And I think that's probably the answer when it comes to this. Like, I am a binge eater. I can binge eat a whole dozen thing of glazed donuts. And then my HS is going to act up accordingly because I probably shouldn't have done that. But I had to get to the root of the issue. What's causing you to binge eat? Like, why are you addicted to sugar? You know, and getting to the root of those questions and figuring out my answer and not what somebody else wants me to say has helped me get to know myself better and my relationship with food and my relationship with my HS. And it is not end all be all like, oh, I figured out sugar's the reason, you know, but it's like, it's a continuing journey. And I think that's just what the HS community doesn't want to hear. They want to hear that there's a blanket treatment, that there's a certain trigger, that there's something specific that's going to make this easier for you. But this is a lifelong thing, baby. We've been doing this for 12 plus years, so we might have a 12 plus more years to go. And we're all just trying to figure that out like day by day.
Yeah. And I think, you know, in regards to the like the weight and the smoking, I totally agree 100%. And I think the way that it came across was more like shut down the conversation, but it's not necessarily a shut it down. I think when that comes across to us, and a lot of times in appointments, it's basically that's what we're left with. They're like, well, stop smoking and lose weight, and then we'll see you in 3 months. There's also no help for smoking cessation offered. There's no registered dietitian or nutritionist offered. There's nothing kind of given our way to help us along with those things or to better understand how they make an impact on our HS or could. And I think that's where a lot of us end up stuck in the community. And so that was my main point in saying that, was just to say like, okay, I'm here for medical management. Help me with this. I know that these things may be important and play a role in my HS, but like we can't solve for those things today. But what can we do medically that can help me at this point? But yes, no, I totally agree. And I think that figuring out your triggers, if you can identify them, because there are also a lot of people who cannot ever identify what a trigger is for them. And spend an inordinate amount of time trying to identify what triggers are, to the point where they're actually creating their own stress from trying to identify a trigger that's stressing their HS. So we have to sometimes just look at it and say, I don't know what is actually causing this to happen for me right now. Like maybe there is an underlying stress that you're just trying to neglect because nobody wants to talk about it, including you to yourself.
And I think sometimes life's just more stressful than others, and it impacts your journey with your HS. Like when I was abusing drugs and like homeless, like all of that stressful time in my life, my HS was chaos. My life was chaos. It reflected her talking about how our brain and our skin are connected. Like it's just that was a game changer for me, because you're so right. And I have seen like just it was like a light bulb went off for me. Like that was really good.
Yeah, I just want to add in like as you're talking, like I'm feeling it in my body, right? This is what it's about. You hit the nail on the head. It's not about the sugar. It's never about the donut. It's never about the cigarette or the pack of cigarettes. The skin issue is not just about the skin issue, right? That's why I love skin in many ways. Like it's such a metaphor for life. There's so many layers. We have to be able to look at what's here on the surface and then be willing to explore what's beneath it, right? That box of donuts, and listen, I'm a sugar girl, just like.
I'm sorry if you can relate. I'm so
I know.
sorry.
Can we get donuts now? Anybody?
Why did you say that, Sid? Now I want to eat a box of donuts. Thanks. My HS flare-ups are y'all's fault now. Okay, I'm putting the responsibility on y'all.
But basically, again, I just want to honor and name, right? Change the for me, skincare is all about relationship, right? It's the relationship between yourself, your mind, your body, your skin. Skincare is everything you think, feel, and do, because everything that you think, feel, and do either shows up on the surface of your skin or it impacts how you feel in it. And this whole conversation and what somatic skincare really is about is changing our relationship with how we perceive our condition. There may never be a cure for HS or any of these other chronic inflammatory conditions, but how can we learn to live with them with more harmony so we can more fully enjoy our lives, right? And part of that is not beating ourselves up when we binge on the box of donuts.
Mhm.
That again is your body's way of saying, hey, I'm overwhelmed.
Yeah.
And I'm going to my survival coping strategy, which has worked for me in the past, which is donuts. Now, the opportunity is to be like, all right, now I feel like crap. My skin is flaring. Next time I feel that overwhelming urge, can I pause for
Yeah.
just a moment? I'm feeling it. This is why somatic means soma is your body, the living body. Somatic is like a body-based, body first. A lot of our therapeutic modalities, psychiatry, it's talk therapy. It's a top-down approach. Working with the body first, understanding where stress is stored in the body, how it's stressed, how you experience it is a body up approach. Knowing that when you're speaking in front of a crowd, like my stomach, I don't know about you, like it might clench up in a knot, or I feel a very buzzy energy in my chest, right? That is, activation of our nervous system. That is kind of that fight or flight, that getting us ready to go. Stress in and of itself isn't a bad thing. It's preparing us to get ready for something. And in many instances, it's getting us prepared to help ourselves deal with whatever is happening inside of ourselves. The opportunity is, can we find other strategies that allow us to deal with the discomfort? Because that's not going anywhere, right? Anger, shame, grief, normal human emotions. So just like joy and excitement, we need to make room for all of it.
Mhm.
We can expand our toolbox to acquire new tools to help us better manage the shame and the discomfort rather than reaching for the box of donuts. Like you said, Brinley, like talk to yourself like you would your best friend. Hey girl, like it seems like you're a little stressed right now. What would be most supportive? What would be most helpful? Do you need a hug? Like I hug myself all the time. And I teach people simple practices of how to, in the moment, on the spot, be able to offer yourself the things that you need most, right? Maybe it's just a compassionate hand to your chest. Or if you're in a public place and you don't want anyone to know that you're stressing, I always wear clothes with pockets in them. So I can put my hands in my pocket and I can kind of, thumb over hand and create a sense of containment or hug myself, but with my hands in my pockets, right? There's little things that are using touch, tapping into our five senses to help us better regulate our own nervous system so that we don't go always to the binging part that ultimately is going to not make us
Feel good anyway. Yeah.
Mhm.
And then we got to live there. And
practice. It takes time and practice.
Yeah.
And just know that when you are binging or you are smoking the pack of cigarettes, it's just your body's way of saying, whoa, 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 whoa. This is too much, too much, too much, too much. I need a little break. So nothing has gone wrong. I think that's where society has gone wrong. They shame us for everything, but your body's so wise. It's found ways to help you deal with the shitstorm that's happening inside of what feels like is happening inside of your body.
Mhm.
So we just need to equip you with new tools. Stock your toolbox with new tools. That's it.
Okay, Brinley, I'm ready to sign up.
I know.
I am ready.
So you teach this, right? You teach this somatic skincare. So like tell us more about that, because I think, we've chatted about this before, and I think there is huge value in what you teach for the HS community especially. And I think we've talked before too about how I think most of us who have HS and those who've been with us through our journeys have experienced some severe medical trauma as a result of this. I don't think most of us are even aware necessarily that we've experienced medical trauma until you actually sit back and take a look at it. And so that's one of the things I would love to know more about. Like, what is your teaching entail, and what can people expect to learn from going through like your process?
Yeah. Thank you. There, it's I'll just name, it's a process. That's exactly what it is. There is no one and done. And I think you all beautifully said it. This is a journey and we're on it together. And the whole premise is to come into, the people say like right relationship. It's not right or wrong, but how do we get into a better relationship with ourselves? Because there may be, our skin may always look the way that it looks, right? Even if you aren't having flares, there's going to be scars.
Mm-hmm.
So is really an invitation to get to know yourself. How, like, in terms of regulating our nervous system, right? Stress is 90% of doctors' visits, upwards of 90% of doctors' visits are for stress-related issues. Skin issues are the number one reason that people go to the doctor. So understanding how stress shows up for you in your body is going to be key. So we spend a lot of time mapping out your nervous system. What does it look like for you? Like, each one of you it's going to show up in different ways. Once you recognize that, okay, now what? Learning how to become more attuned, right, to the rhythm of your own body, and teaching you practices mindfulness, right? Mindfulness is paying attention with intention in the present moment without judgment, not trying to make it different. That's where shame comes from. We think what's happening shouldn't be happening, and then we judge ourselves for it. So part of the teaching is learning that what is happening is happening. Not trying to change it, but how can we learn to be with it? So I teach breathwork techniques. We do visualization, various meditations, movement. How can we be more free and move in this beautiful body of yours? I think a lot of people with HS, right, oftentimes there's limitation in movement because of active abscesses or scar tissue that has made it very difficult. So how can we move the energy through that feels stuck? How can we physically move the body in a way that works for you? So each week in this, I work with people in many different ways, one-on-one, but in a group setting, it's a 10-week program. And every single week, we get to know ourselves, become, the relationships we have with our bodies, with food, with sleep, with our environment, the people in our lives, setting boundaries, and then learn a practice that goes along with that so that you are steadfast. You always can come back to the wisdom of what's in here, right? The wisdom of your body. It's always there. And it's a matter of, kind of peeling back some of the layers to be able to access it. And unfortunately, in the medical system, from your lived experiences, you've had to cover a lot of that wisdom with layers of shame or people pleasing or all the other things that had to be done in order to feel like you could navigate the world without judgment. But really, the judgment that we need to shed the most is the judgment that we place upon ourselves. And that's what we really work on together in Somatic Skincare.
Yeah, that sounds amazing. And I know we're going to do a smaller group with you going through the 10 weeks. And I'm super excited about doing that because I think there's so much to be learned and gained that not just will be applicable to our HS through this process.
Yeah, I'm like, you're going to change my life.
I know.
Okay, girl. Hello.
Yeah, I feel like our HS has made us special people. Yeah. Like we have had to endure and kind of overcome a lot of obstacles that we don't necessarily give ourselves credit for. And when you actually start thinking about it, it's kind of overwhelming that we have made it through all of this time where we have put ourselves last or made ourselves feel horrible about our situation, and still we're here and we rise and we talk about it. And I've personally been so floored by how much weight has been lifted off of me just by talking about my HS.
Yeah.
So when you had mentioned, Hala, like going to the OBGYN and saying like, okay, do you know about HS? Like, it may seem like a huge thing, but that's like the best way to approach it too, is if you start the conversation, then you get to own that a little bit more, and you're the one bringing it up instead of being like, oh, I'm just going to wait for this really awkward situation where they notice. And then do they say something? Do they not say something? And then if they do, is it because it's really bad? Or you know, and have all of this upheaval inside yourself, that I think we set those situations up sometimes to be like that because we don't know a really good positive way to handle it. And it sounds like this, you know, with Dr. Barr, you would be able to like help us understand more about that. How is that going to impact you so that you can then make good, educated choices on how you're going to handle those situations too.
Right. I mean, listen, we can't control anyone else. We can't. We'd like to, you know, our kids, our partners, the people aren't, we can't.
Heavy on the partner.
We all want to say heavy. We all said, partner.
My kid who's right here.
But we can, and sometimes we our body's going to do what it's going to do, but we can be more attuned to ourselves and be able to steady ourselves so that we can better interact with the people around us, right? Your point of, yeah, going to the OBGYN, and it's not even, do you know about HS? It's kind of like, hey, I have HS and it's flaring right now, FYI. And it may be a little uncomfortable. It's hard for me to lay on the exam table. Do you have a cushion? Or I may be oozing a little bit. Is that okay? Can we put down an extra? Ask for what you need.
Yes.
No one knows what you need. No one knows your body better than you do. And most of us, even as physicians, we're kind of looking for guidance of like, I don't know how best to serve you. Can you help me help you? I mean, like I said, unless your doctor's a complete asshole, like we want to see you succeed.
Yeah.
But we don't know how because we don't fully understand what is happening for you in this moment. How can I best support you in this moment? And I won't know unless you can tell me. Now, I appreciate that it may feel exhausting that the onus has to be on you. I have to educate you about everything. Not necessarily, right? The onus does have to be on the other person as well to know about the condition, to be well-versed, if not, refer you on to someone who does. But I think it's absolutely vital for your own self-preservation to be like, hey, I need XYZ in order for me to get through this exam in a way that I can maintain my dignity and, you know, my self-preservation. Now, you don't actually have to verbalize that, but like, you know what, like to know that for yourself going in, like, what do I need in order to feel really good, or at least good enough in this situation?
Yes.
Well, I think what I've really taken from this episode as well is so much is just a deeper issue than even what I think it is. Yeah. So already I'm realizing my issue might not even be the shame from the dermatologist. It's my anxiety, not even wanting to ask or not even wanting to say anything.
Yeah. And I feel that anxiety, like when you get there, you know?
Yeah. And I'm creating a scenario that probably isn't even a scenario because of my anxiety, not necessarily because of my HS. So I think I love the work that you're doing, and I just love, I'm going to keep going, plant your feet, Mahala.
Yeah.
Plant your feet, Mahala. Just plant your feet, because it does do something, you know, it brings you in the moment.
Yeah. So. And it's starting somewhere. Like,
yeah,
and that's,
somewhere.
I think that's where we all have to start at the beginning, wherever that may be. And then if, you know, you're making progress, it doesn't mean you're starting over. You're just picking up where you left off from at the last point.
And I think it gets to a point with all of us, like, what we're doing is not working, you know, like I think, and you just got to try something new. You have to be open to new practices and new things. If it's broken and you ain't fixing it, you might as well try something else, you know?
So where can people learn more about your somatic skincare practice and how to work with you?
So I'm on Instagram at Dr. Keira Barr, and I have a link in my bio there. There's information, my website, drkierabarr.com. People can reach out to me and have a conversation. You know, not every, I'll name, this is simple in theory, right? It's not easy. You have to be willing to do this. And to your point, like, it's just like, again, skincare, it's like exfoliating the layers that are no longer serving you.
Yeah.
And you have to be ready and willing, because this is not a one and done. This is an ongoing process. We're going to keep learning about ourselves. We're going to get stronger and increase our resilience. But shame is never going away. Discomfort is never going away. But what does go away is the discomfort of being with the shame. Being, right? We get better at learning how to manage it. And I just want to offer, you know, before we kind of wrap up, remember that your skin is your greatest asset and your greatest ally. It is not here to sabotage you. It is doing the best that it can with the resources that it has to keep you alive, to keep you protected, and to keep you safe. And I think so many of us, myself included, we look at when something shows up on our skin that we don't like, it's like, this is crap, this is bad, my body's, right? Not to fight against ourselves, but how can we work with ourselves to, enjoy this life that we have? And every moment is a new opportunity to start again, to offer yourself some compassion, some grace. When your HS is flaring, that's tough stuff.
Yes, definitely.
Do the best that you can, right? And having this community that you have created is incredible. And the more you talk about it and diffuse that anxiety, like, it's understandable. Of course, there may be some anxiety. Of course, there may be some feelings of shame. You're living in a society that like creates that scenario where it's like impossible not to, but you are doing amazing and you're doing the best that you can. And there's also opportunities to support yourself in ways that may feel a little bit better.
Yes. I think that
isn't serving you, but it's a process.
Yes. And I think, especially we want overnight success, especially after dealing with things for so long. You're looking for it like, okay, well then I'm not doing this hard enough or fast enough or, strong enough or putting enough effort in. And it's like, no, sometimes it's just, it takes time to do that.
Again, shed those layers, shed that shit, exfoliate that. Yep. That's not working.
Yes. Exfoliate that shit. Oh my god,
layers. This was so good. Yeah. And I feel like you genuinely, like, if I know I'm like tearing up sitting here, you're going to impact so many lives of people who are not only dealing with HS, but just dealing with things that make them feel kind of the same way that we feel, whether it's your skin, whether it's your acne, whether it's just childhood trauma, just working through listening to your body and how to be in that moment and overcome whatever is happening to you right now. So I want to thank you on behalf of like me and like my community that I created, because I'm like, oh my Lord, I'm over here tearing up. This is beautiful. Yeah.
Thank you so much for coming today. Yeah.
Yes.
Pleasure. I want to thank you. I mean, like you said, Brinley, you having HS makes you a special kind of people, and it does. And you are changing the world. Sharing your message, showing resilience. And like you said, this doesn't just affect you. And I know, Brinley, for your daughters, like, this has a ripple effect on every person that you are in contact with. So keep talking, keep sharing, because this ripple effect, it's far, it's wide. So I want to honor all of you as well. So thank you so much.
Oh, thank you so much for being here. I truly appreciate it. And I'm sure I'll be emailing you after this anyway. So.
And they can find you again where? On Instagram at?
Dr. Keira Barr.
And we'll link it in the show notes too.
Perfect.
So.
Awesome.
Thank you so much, Dr. Barr. We appreciate it.
My pleasure.
We want to thank you guys for tuning into this episode of the Hidradenitis SuppuraDIVAS podcast. It was so special, and we are so thankful to Dr. Keira Barr. And you know where to find her on Instagram. And be sure to make sure that you're subscribed so you don't miss the next episode. And that's a wrap. Thank you so much for tuning in to the Hidradenitis SuppuraDIVAS podcast. We are so thankful to UCB for sponsoring this episode, and we cannot wait for you guys to tune into the next.
We're the Hidradenitis SuppuraDIVAS. If you've got HS, you'll want to meet us. It's not your fault. Put the shame to a halt. HS divas know how to have a ball. The Hidradenitis SuppuraDIVAS. Put the shame to a halt.